A permanent tracheostomy is the surgical opening made to see the trachea. A cuff tracheostomy tube is then inserted. The cuff is meant to occlude the space between the tracheal wall and the tube. The tracheostomy is held in place by tape fastened around the patient's neck or with a commercial tracheal tube holder. Sterile gauze will be placed between the tube and the skin to absorb the drainage. The patient now breathes through the stoma in the lower neck. Nursing diagnosis and goals. Nursing diagnosis. Ineffective airway clearance related to copious tracheobronchial secretion. Fatigue and activity intolerance related to impaired respiratory function. Planning and goals. Improve airway patency. Increased activity. Maintenance of proper fluid volume. Adequate nutrition. Understanding treatment protocol and preventative measures, and absence of complications. Laryngectomy is the complete removal of the larynx, used for the cure for most advanced laryngeal cancers when it goes beyond the vocal cords, or for a cancer that recurs or persists beyond radiation. The laryngeal structures are removed, including the hyoid bone, epiglottis, cercoid cartilage, and 2 to 3 rings of the trachea. The tongue, pharyngeal walls, and the trachea are all preserved. This results in a permanent loss of the voice, change in airway, and a permanent tracheostomy. Priorities of care. Monitoring and assessment of ventilation is continuous. Vital signs: place in a semi-Fowler's position to promote ventilation, drainage, decreased edema, and prevent the strain on the suture line. Analgesics. Use these cautiously because this could decrease cough suppression. Alleviate apprehension by providing communication aids. This includes such things as pencil, paper, call light, or a whiteboard. Any crusting that builds up should be cleaned with a solution of hydrogen peroxide and saline.